滿分不是夢啊，教你逐步去解答問題嘅。
君の笑顔の意味を何も知らず、僕たちは大人になった。
2022年第6條題目係有關於胰臟嘅。下面呢一幅示意圖啦，就展示咗人類胰臟唔同類型嘅細胞嘅分佈，分別有細胞類型 P 啦，同埋細胞類型 Q 嘅。咁都係嗰句啦，有翻好習慣啦。細胞類型 P 啦，其實就係製造胰液嘅細胞啦，而細胞類型 Q 咧就係製造荷爾蒙嘅細胞嚟嘅。咁點解我哋會知道咧？正就係題目問我哋嘅嘢啦。邊一類型嘅細胞係分泌激素、分泌荷爾蒙嘅呢？就利用翻圖中所示嘅一項可以觀察到嘅特徵咧，去支持我哋嘅答案咯。咁呢條題目啦，就梗係考翻我哋閱讀圖像啦。而當中要考我哋嘅咧係兩步。第一步啦，就要去揾翻嗰一個可以觀察到、睇得見嘅特徵先。然後啦，就將呢個特徵咧，就同荷爾蒙分泌咧，就拉上關係啦。咁啊，當然要同大家溫一溫書啦。就係啦，外分泌腺 exocrine gland 同埋內分泌腺 endocrine gland 兩者啦，究竟有啲咩嘅分別咧？睇翻幅圖啦，大約都知得到啦。頭先我講嘅 cell type P 咧，就係分泌胰液嘅細胞類型嚟嘅。咁啊，我哋見得到啦，有呢個 pancreatic duct。咁啊，因為外分泌腺咧，咁就有個管道，就將個分泌物咧就帶到去個目標器官嗰處嘅。而相反咧，內分泌腺咧，佢係冇一個特定管道去運送個荷爾蒙，而係透過血管咧去運送嘅。所以啦，好快咧，我哋就知道啦，紅色咧就係一個可以見到嘅特徵，就係啦，你會發現 cell type Q 咧係附近咧係有好多血管嘅。咁你可能話啦，我寫唔到呢個 in close proximity to cell type Q 喎，未講咯。cell type Q 咧 is supplied with blood capillaries 咯。嗱，係咪真係 rich 咧？呢度咧就真係睇唔到係咪叫 rich 嘅，但起碼呢幅圖我哋見到有微血管喺附近啦，係咪？咁你證明咧，荷爾蒙係直接釋放分泌去到個血液入面嘅，即係代表住內分泌腺所分泌嘅激素係會直接擴散入血液咯。係咪有紅色同埋紫色啊？就係可以見到嘅特徵，同埋同個荷爾蒙分泌嘅關係咯。除此之外咧，就係另一款答法啦。外分泌腺同內分泌腺嘅分別咧，就係外分泌腺係會通過一個管道去釋出嘅。你而家見到啦，細胞類型 Q 咧，其實佢係冇一個特定嘅管道去運送嘅，相反咧，佢係透過血管去運送嘅。所以啦，你都可以講翻咧，細胞類型 Q 咧係冇一個特定管道去連接住啦。所以啦，分泌出嚟嘅荷爾蒙咧係應該分泌去到血液嗰處嘅。所以咧，內分泌腺咧就稱之為無管腺 ductless 啦。其實過往咧都有唔少題目咧係考翻胰臟嘅角色嘅，無論係內分泌嘅角色，又抑或係消化嘅角色，大家都要溫翻書咯。跟住啦，就係到拍 B 啦。而家有一個人咧就慢跑緊1個鐘，咁啊要我哋描述一下啦。喺慢跑嘅期間咧，呢個胰臟嘅激素係點樣調節翻呢個人嘅血液葡萄糖嘅水平呢？4分喎，哇咁長嘅呢條題目，咁而家就同你逐一拆解咯。其實成條題目啦，就係考翻體內平衡嘅啫。體內平衡係咩意思呢？就係我哋嘅身體嘅一個能力嚟嘅，係一個 ability 嚟嘅，就係去保持翻我哋身體嘅內在環境係處於一個相對上平穩穩定嘅狀態。咁呢個就係叫做體內平衡啦。過往啦，我都拍咗段片咧，去解釋翻體內平衡嘅題目嘅。滿分不是夢啊，教你逐步去解答問題嘅。而當中啦，一提及體內平衡咧，不得不提嘅就係負反饋嘅機制啦。負反饋機制咧，過往我都講過俾大家聽噶啦，就係喺我哋身體一個特定嘅水平，一個特定嘅因素，例如我哋嘅血糖水平啦，佢係偏離於正常水平嘅，就會引發到一個修正嘅反應，而呢個所謂修正 corrective response 修正反應咧，其實就係一個相反嘅反應啦。當某一個嘅水平佢係有個改變，而呢個修正嘅機制咧，就係將佢帶翻去正常水平啦。例如啦，血糖過高嘅時候，你嘅修正反應就係將佢向下調整啦。而 而血糖過低嘅時候呢，我哋嘅修正反應就係相反啊嘛，就係將佢向上調整，即係增加翻咯。成條題目4分，應該點樣答呢？又睇一睇我哋嘅思考鷹架咯。過往呢，梁 Sir 都提過大家噶啦，其實讀 Bio 呢唔難嘅。首先啦，我哋咧要有一啲定義啦，例如啦負反饋機制嘅定義啦，然後啦就透過一啲指引性嘅題目去幫助自己去思考咯。例如啦喺而家一個特定嘅情況底下，我哋嗰一款嘅因素，例如血糖水平啦，有啲咩嘅變化咧？而呢個變化啦，你要講得出，佢係高於正常水平啊，定係低於正常水平咧？第二啦就係我哋嘅終極目標啦。如果頭先我哋一個特定嘅因素，佢嘅水平啦，係增加或者下降嘅時候，咁我哋應該要點樣做呢？我哋嘅修正機制係相反噶嘛，咁應該點做呢？過高就要撳翻低咯，過低就要戳翻高咯，但係戳翻高撳翻低都要去翻正常水平喎。去到第三啦。既然我知道要戳高或者戳低啦，咁究竟有啲咩嘅機制係牽涉喺當中呢？啲咩嘅感應器或者反應器係牽涉喺其中呢？咁啊睇翻第一步咯。而家當呢個人跑緊步嘅時候啦，對於我身體有啲咩嘅變化呢？其實就係個刺激咯，就係我哋嗰個改變啊，係咪啊？究竟血糖水平有咩變化呢？有啲咩字眼你係需要提到噶？我哋做緊運動啊嘛，跑緊步啊嘛，係咪？肌肉有收縮嘅。我哋嘅肌肉細胞咧進行緊呼吸作用嘅，咁呼吸作用需要啲乜嘢呢？自不然就係血糖啦，係咪？咁當啲肌肉細胞拎啲血糖嘅時候啦，咁究竟我哋嘅血糖水平有啲咩嘅變化呢？自不然啦，就係講緊當我哋慢跑嘅時候，肌肉細胞就會喺個血當中去吸收葡萄糖，去進行呼吸作用，去俾啦釋放能量咧，就支持翻肌肉收縮咯。故此咧，血糖水平就會下降，第一步完成咯。第二步啦，咁我哋終極目標係乜嘢啊？而家血糖係低於正常水平啦嘛，咁我哋要做翻相反嘅效應，自不然就應該要提翻高啦，係咪啊？所以到頭來咧，我哋就要諗辦法提升翻血糖水平，去翻正常水平咯。嗱，記住，作為一個負反饋系統咧，我哋唔係話啦，低去翻高咯，高落翻低咯，係去翻正常水平啦。然後第三步啦。機制啊嘛，係咪啊？有啲咩嘢係牽涉喺其中㗎？究竟我哋做咗啲乜嘢先？我哋就諗下啦，胰島素啦、高糖素啦，喺我哋嘅細胞儲存咗嘅糖原啦，同埋啦釋放翻出嚟嘅葡萄糖，釋放去邊度呢？我哋逐一擊破咯，我哋又嚟逐一擊破咯。當血糖低於正常水平嘅時候，呢個改變呢就會刺激咗個胰臟去釋放多啲嘅高糖素，而係釋放少啲嘅胰島素。喺呢一個綜合咗嘅荷爾蒙反應咧，就會刺激咗個肝臟細胞，將一啲儲存咗嘅糖原咧，就轉化成葡萄糖啦。而呢啲葡萄糖再釋放翻去血嘅時候，就能夠提升翻血糖水平，去翻正常嘅水平咯。所以你會發現啦，當我哋諗嘅時候咧，平時做練習嘅就係1、2、3咁樣諗咗先，確保你所諗嘅嘢係正確嘅。而當你表達你嘅答案嘅時候呢，可能個次序就要轉一轉咯。先講翻我哋而家身體體內嘅變化啦，然後再講下有咩嘅機制係牽涉喺其中，從而啦就引申翻一個修正嘅反應咯。所以啦就會變咗1、3、2咯。但係無論係1、2、3嘅思考方法，定係1、3、2嘅表達方法呢，只要你個概念係夠清晰，加上適當嘅生物科字眼嘅話咧，其實你嘅答案都係標準答案嚟嘅。所以點解我一直教大家啦，有翻基礎嘅概念啦，然後再利用問題去幫自己建構答案啦。嗱，睇翻呢段片溫溫書啦，呢啲題目係真係睇住嚟食嘅。好，今次咧就嚟到一點出發啦。今次嘅題目咧就由胰臟開始，陣間咧我會講一講有關於體病學 Bio 嘅。而呢條題目啦，問我哋嘅咧分別就係內分泌腺啦，同埋外分泌腺啦。先講翻內分泌腺啦，有關體病學 Bio 嘅，有自不然咧就一定講糖尿病噶啦。過往都有好多糖尿病嘅題目啊，咁啊又係快啲睇下片溫下書咯。跟住啦，就去到激素嘅協調，亦都關於我哋嘅體內平衡啦、負反饋機制事啦。咁睇翻呢兩幅圖啦，就係去做翻一個歸納。你而家嘅血糖水平高過正常水平，你低過正常水平嘅時候啦， 咁究竟我哋身體做咗啲乜嘢嘅機制，從而啦就修正翻我哋嘅血糖水平呢？然後啦就去到人體生理學咯。咁過往我都拍咗幾段片咧，去解釋翻啦體內水分啦、血液內嘅氣體成分同埋體溫咧嘅一啲題目嘅。咁啊快啲睇翻 elective 嘅片溫下書咯噃。跟住啦就去到外分泌腺，佢嘅角色自不然就梗係消化啦。咁當中啦有關體病學bio咩事呢？就係當我哋嘅胰管閉塞咗嘅時候啦，究竟又會引起啲咩嘅疾病呢？咁過往都拍咗一段嘅就係胰臟疾病浪漫愛情故事，咁大家又睇下片溫下書咯。咁其實咧呢條題目係非常之好嘅，佢係可以解釋到俾你聽咧，胰臟咧佢係一個非常重要嘅器官。內分泌腺又係佢，外分泌腺都係佢，即係話如果一個人佢嘅胰臟有疾病，例如胰臟癌嘅話咧，會好嚴重咁影響佢嘅健康嘅。222 question 6 is about the pancreas. So you can see from this diagram, it illustrates the distribution of different cell type in the human pancreas. So you can see the cell type P and the cell type Q. As a good practice, you need to realize what are they. Cell type P is the pancreatic juice secreting cells, and the cell type P, it is the hormone secreting cells. How can we know it, and how is it so important to point it out first? Because for part A, it asks us that which type of cells, P or Q, secretes hormones, and support your answer with one observable features illustrated in the diagram. So in this question, it's checking us the diagram reading, and then it needs us to identify the observable feature of the pancreas. We need to do the deduction from the features in relation to the hormone secretion. So let's do the revision about the concept that to distinguish exocrine gland from endocrine gland. From the diagram, you can see that cell type P and cell type Q. So what are they? You can see that for the cell type P, it is the endocrine gland because they are in close proximity to the cell type Q. If you cannot say that in close proximity to cell type Q, at least you can say that cell type Q is supplied with capillaries. Is it really richly supplied? We do not know. At least they are supplied with capillaries. And what about the So how is this function related to the hormone secretion? Because the hormones will be released into the blood directly. But for the cell type P, you can see that there is a pancreatic duct connected to the cell type P. Therefore, we can see that endocrine gland differ from the exocrine gland, for example, salivary gland, gastric glands, which release their secretion through duct. This time, we have the pancreatic duct. For there is another answer. There is no duct connected to the cell type Q. Therefore, the hormone secretion should be released into the blood. It is the same idea, but we are using two different observable features. Since the hormones are not released through duct, endocrine glands are also called ductless gland. In the past, there were different types of questions related to the pancreas structure, insulating producing cells, how important is it, any organelles in the pancreatic cells. So watch the video for revision. And then for part B, a person jogs slowly for an hour. We need to describe how the hormones from the pancreas can regulate the blood glucose level of the person while jogging. So for this question, it checks out the critical concept about the homeostasis. So what is homeostasis? We need a definition. Homeostasis is the ability of the body to maintain a stable or relatively constant internal environment. For the internal environment, it could be the blood glucose level, body water content, gas content in the blood, and body temperature, and so on. And then you can watch this video for the revision. How can we score full mark for the homeostasis question? After we talk about the homeostasis, surely we need to talk about the negative feedback mechanism. So the negative feedback mechanism, according to the definition, it says that any change of a factor, for example, blood glucose level, gas content in the blood, away from the normal level, higher than normal level or lower than normal level, will initiate a corrective response that return it to the normal level. So you can see that for the negative feedback mechanism, the corrective response is a opposite effect to the changes in the parameter. This parameter, as what I mentioned, it could be the blood glucose level, it could be the gas content in the blood, it could be the body temperature, and so on. After that, I need to talk about the scaffolding. How can we score 4 marks, full marks in this question? So in the video, I teach you that using the guiding questions, think and to construct your answer. First step, we need to mention any change of a factor away from the normal level, higher or lower than the normal level. For example, the body temperature or the blood glucose level. After that, we know the change of the factor. We need to think about the ultimate goal, and which is related to the corrective response. What if the factor is higher than the normal level? So the ultimate goal should be, I want to lower it to the normal level, right? So what about the factor is lower than the normal level? So my ultimate goal is to make it higher and return to the normal level. And then for step 3, what is or are the mechanisms involved to restore the normal level? So any receptors or effector are involved. So let's take a look at the scaffolding. Let's go through the step. Step 1, what condition is the person facing while jogging? So it is the stimulus. So you need to mention about the muscle contraction while jogging, respiration by the muscle cells, and then any change in the blood glucose level. So during jogging, muscle cells continue to take up the glucose from the blood to release energy by respiration to support the muscle contraction. Therefore, the blood glucose level will drop and lower than the normal level, right? So not only drop, but drop lower than the normal level. And then for step 2, what is the ultimate goal for the blood glucose level regulation? It is our corrective response. So the opposite effect to the change in the blood glucose level. It means that now we know that the blood glucose level dropped and then be lower than the normal level. Therefore, we need to increase the blood glucose level back to normal or maintain the normal blood glucose level is the response and our ultimate goal. So step 3, what is the mechanism? How is the blood glucose level being regulated by the hormones? So you need to recall the mechanism, the hormones involved: insulin, glucagon, stored glycogen, glucose to be released. And surely, don't forget the receptor and effector. Therefore, we need to mention that after the blood glucose level will drop and lower than the normal level, it stimulates the pancreas, which is the receptor, to secrete more glucagon and less insulin. And the hormone combination stimulates the liver cells, the effector, to convert the stored glycogen to the glucose. And then the glucose will be released to the blood. Therefore, the blood glucose level will be increased to the normal level. So you can see that the thinking logic will be step 1, 2, 3, the stimulus, response, and the mechanism. So how can we present our idea in an easier way? So we can talk about the changes and then mention the mechanism. Oh, how is the receptor, effector, and any hormones involved? And then talk about the response. No matter which order, the idea is that you need to have the clear definition of the concept and then use the guiding questions to lead you to think and construct your answer. And then let's talk about the curriculum mapping. This question, it starts from the pancreas, and later on I will talk about the disease approach. And then this question checks us the concept about the endocrine gland and exocrine gland. So for the endocrine gland, diabetes is a very classical example of the disease. So you can watch the video before for revision. And then let's talk about the homeostasis, hormonal regulation. Surely, we need to talk about the negative feedback mechanism as well. Summary from the textbook is very useful. And then you can use the guiding question to consolidate your concept, your knowledge. And then for the negative feedback mechanism, is also related to the human physiology, one of our elective subjects, about the water content, blood gas content, and the body temperature. And after that, for the exocrine gland, we talk about the digestion. Disease, we can think about it. So for example, we can talk about the blockage of the pancreatic duct. So please watch the video in English version for your revision. This video is absolutely useful and it tells you that pancreas is a very important organ in our body. Some patients, they are suffering from the pancreatic disease, for example, pancreatic cancer, so it will be a disaster.